Okay guys, we're going to talk about urinary tract infections after sex, which is the bane of existence for many women. It's really important, first of all, to know your anatomy. So first of all, if you're looking at yourself with a mirror, this would be really helpful. First, find the fatty lips of your vagina. They're right, the fatty part, obviously, and you have to spread them open to be able to look at the urethra, which is a small opening right at the top. And then right underneath that opening, you're going to have the vaginal opening. Now, the vaginal opening isn't round like this, round and open. It's a collapsible tube, so it's actually going to be a little bit closed off, okay? So that's your vaginal opening. And then take a look at where your anal opening is, right here. It's really important to understand how far your urethral opening is from your anal opening. So the distance from your urethra to your anus could be maybe about 2 inches to 3.5 inches. That's not a lot. Break out a ruler. Take a look. That's not a lot at all. The other thing to know is, where is the bacteria that causes the infection after sex coming from? It's coming from the skin around your anus, the anal opening, okay? Pretty much all of the infections that are gonna, all the bacteria that's gonna infect you is coming from the bacteria from your gut. Yeah, you're wiping clean, I get it, there's no stool left, but you can't wipe away all of this microscopic bacteria. And they live right here around the anal opening, a little bit up into the perineum, you know, where you split when you had a vaginal delivery. That one, that area. The area between your vagina and your anal opening is called the perineum. All right, the perineum. So when you're having sex, essentially the male reproductive apparatus, let's just use it like that, and that's how we're going to picture it, probably is not going to go directly into your vaginal hole, okay? It's probably going to start at the perineum, right, this area right here, and then it's going to touch this area and then drag up into the vagina. And look how, you know, depending on your partner's size, look how wide it is. It's probably going to touch your urethra on the way into your vagina. So it touches this whole area, okay? Look at what happened to the bacteria. The bacteria at your anal opening and a little bit up the perineum got onto the male apparatus and now was introduced right into your vaginal opening and in your urethra. Oh my God, look at all that bacteria. Now, a lot of women have the ability to defend themselves against an actual infection that goes into the bladder. But there's some women who, for many reasons, or different kind of reasons, aren't able to defend themselves against the actual bacteria that is now sitting on the outside of their urethra from moving in, okay? So bacteria essentially almost has like different mechanisms of actually moving. So they can actually, almost in a way, walk into your bladder and then cause an infection where they multiply, and now, you know, there's a big infection and they're having a big old party. These are some balloons, okay? So now they're having a party and it's a full-blown bladder infection. So different people have different problems that could cause a problem with their self-defense mechanisms. So if you're having this issue, talk to your doctor, your primary, your gynecologist, urologist, urogynecologist about this issue and about what can be done to help prevent or reduce the number of infections you get after sex.